Hi Fetish fans, and welcome to Skin Fetish, a place to get obsessed with skincare, lifestyle, and beauty. I'm Judy Moyes, your licensed esthetician. In this segment of the Advanced series, we are on location at Bowden Eye and Associates, where I'll be speaking to our guest speaker, Dr. Sarah Darbandi. Dr. Darbandi is an ophthalmologist that performs general eye care as well as cataract and refractive surgery. Today, we'll be talking about aesthetic services that Dr. Darbandi does perform, and that includes Botox, fillers, and lid blepharoplasties. So please help me welcome Dr. Sarah Darbandi.
Hi Judy, thank you so much for having me today. It's a pleasure to be here and speak to you and our patients and fans that might be listening in today.
Yes, thank you so much for joining us today.
You're welcome.
So please tell us the difference between an ophthalmologist and an optometrist.
Sure. This is a common question that we get because we all fall under the category of eye doctor. And so an ophthalmologist is somebody who's gone through a few years of medical and surgical training in order to be able to perform injections, surgical procedures, things of that nature. And our optometrist colleagues are ones that do a great job of screening for medical diseases, and they're also experts in fitting for glasses and contact lenses. And so the difference is basically that the ophthalmologist would be the one to be able to perform, surgical procedures, injections, things of that nature.
That's perfect. Thank you for telling us the difference, because that is something that people don't really know. So now they know who to look for if they need a particular procedure to be performed. Mm-hmm. Now, cosmetic services has increased significantly, especially for the upper and lower lid surgeries. Are there any non-surgical procedures that you may offer?
Oh, yes. In addition to the surgical procedures, we have a lot of patients coming in that are taking more, notice of how their eyes look, whether they're because they're wearing the mask or in Zoom conferences. I've had a lot of people come in, with questions about what we can do for them in the office because they may not be ready for surgery. And so I'm very happy to offer, the typical Botox that we, normally offer to help the lines around the eyes, that kind of thing. But additionally, I also offer lower eyelid filler. And so just like in your line of work, I'm sure, a common complaint is the dark circles underneath the eyes that makes everybody look tired. And so with the filler procedure, I basically can use cannulas, avoiding, needle injections, that kind of thing, in order to restore a more natural appearance. And so with putting filler into the tear trough area where we might be a little bit hollow, it basically creates a nice lid to cheek transition, smooths everything out, helps you look very restful, and helps maintain a more youthful appearance. And the great part about this procedure is that I do it in the office using minimal injections. It takes about 30 minutes. People see instant results, and there's really not much bruising, swelling. There's very minimal downtime. So it's a really nice thing. And then for skin tightening, we now have something called Plasma Pen, which is by the company Nuvisa. And this is basically, if you imagine a little handheld pen that creates a little lightning rod of heat treatment, that's like doing a little handheld, almost resurfacing in the skin. So this laser treatment helps to tighten the skin, stimulate collagen, elastin, minimal downtime, about a week of healing. There's no really not much maintenance to do afterwards. It's not very painful at all. We just use numbing cream, not even injections, and then people enjoy a nice result. And they can even have the treatment repeated, about 8 weeks later as they feel they need to. So there are a lot of non-surgical options these days that are out there, that a lot of people don't realize.
That is perfect information, especially about the downtime. So for the patients that have an option, that's good to know.
Oh, yeah.
Besides the services that you do offer, are there any other aesthetic services that you perform?
Yeah, I do Botox, to the glabella lines, to the forehead. I oftentimes even, help patients with, putting Botox underneath the brows to allow for a kind of chemical lift, because people don't realize sometimes that there are other places that we can put Botox that help to weaken the orbicularis muscles and basically help to stop that pulling down and helped with a lifting of the eyelid. Mm-hmm. So that's kind of a nice thing. And then besides that, doing the upper and lower eyelid blepharoplasty surgeries is something I offer as well.
That's awesome. And for people to not know, Botox could be used for various ways. Then they'll know exactly where you could use it and have the results that they're looking for.
Oh yeah, exactly. And it all starts with a consultation. I think that just knowing that people are bothered by something around their eyes, whether it's heaviness or, asking themselves, am I lifting my lids, to see better, or to get a more open-eyed appearance. There's even an eye drop that we offer that patients can get from an ophthalmologist or an optometrist called Upneek, and it's a prescription that basically is an eye drop that you just put in your eyes, and the eyelid muscle that can basically droop down a little bit. Both eyes can seem like the eyelid is droopy. Sometimes patients have one eyelid that seems lower than the other. That's a condition called ptosis, where many people have it and don't realize it. Sometimes, we put on heavy lashes, things like that, and that creates a ptosis. Or we're just tired, or we've been staring at the computer all day, and that causes the lids to droop. So it's pretty amazing to be able to prescribe a drop that allows people to have this immediate eyelid lift, that makes them look, bright-eyed, and more awake. So that's a very a positive, aesthetic appearance too.
It's amazing how everyday occurrences could affect your vision, and for you to have solutions is just amazing.
Thank you.
Now, for these services, does medical insurance cover?
That's a great question. So, for the medical coverage, a lot of people don't realize there is medical coverage for upper eyelid blepharoplasty. And so for patients that have this extra eyelid skin that's resting on the lashes and creating a visor effect, that's actually something that blocks the side vision out. So I always ask patients, well, do you feel like you're lifting your lids to see better? And if you lift up the extra eyelid skin, can you see better? And so that's where insurance recognizes that we are assisting and improving the peripheral vision by doing this surgery. And so we do special testing in our office, checking the visual fields with the lids down and lids taped up to show the difference. So we have these metrics that we use to show that somebody should be medical. And I'll say most patients, about 90% of patients that come in for the upper eyelid surgery with those complaints, are covered by their medical insurance. And then post-operatively, I'll hear them, tell me how much better, things are when they're driving, when they're doing their activities, even putting makeup on, they have a much easier time seeing to do it. So that's something that I think a lot of people don't realize, and it's such a slow aging change that many of us will get. That it's been a really nice thing to be able to present that to somebody and say, oh, by the way, your insurance covers it. So,
oh, sure. What a sweet deal, as far as a package as well.
Yeah.
That is awesome.
Yeah.
Now, with all the services that you offer, what is your favorite that you like to perform?
That's a great question. I love doing all of the surgical procedures. I do cataracts, cornea work, lid surgeries. I think one of my favorite things has to be the lower lid filler, because it sometimes surprises people of how natural of an appearance you can get by putting the filler not in the cheeks to bulk them up like we see so many times, creating this more less natural appearance, but putting it right underneath the lids. I also love offering it because not everybody who injects fillers offers the under eye area. Some people are hesitant to treat that area because they don't have the experience, whereas I feel very comfortable as somebody who does surgery on the lower lids. I understand the anatomy, and so doing the fillers is something great that I offer people. They can do it same day, and then just like in your world, it's just wonderful to see somebody so, excited about what they just had done. They look in the mirror, you can tell that they feel great about themselves, and to be able to, give that to somebody is just a really wonderful gift to be able to offer patients.
Yes, I totally agree with you. That's one thing that I do love about our industry, the aftermath of the effects of whatever procedure or services that they have is just a great feeling, both sides. So I totally agree with you. Any closing statements that you'd like to tell us? Or
just like to invite people to, seek out, our practice, an ophthalmologist. I think that's a great place to start, to find out about some things that are available. They can visit us at our website, bowdeneye.com. They can call our office, which is 904-296-0098. We're very available online, or you could even stop in and make an appointment.
That is great information. Thank you so much
You're
for
so
that.
welcome.
And I know that the viewers will be so appreciative about your information and all your expertise as well. So thank you so much,
You're
Dr.
so welcome.
Darbandi.
Thanks for having me. I appreciate
Yes,
it.
thank you. And if you would like to get more information, Dr. Darbandi did mention as far as how you could reach her, but please call for your consultation so you could get some research. Not necessarily if you will choose her as an ophthalmologist, but I would rather you, but just do your due diligence and making sure you do your research to make sure you get the results that you're looking for. Thank you so much for tuning in Skin Fetish. It is your time to get obsessed with yourself.